You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. According to my first guest, your teeth and your gums are never too bad to have the smile you've always wanted. With us, we have Tampa's go-to dentist, Dr. Roderick Davies. Dr. Davies, welcome to the program.
Hi, thank you for having me.
All right, now I know you brought a lot of before and after photos that are pretty dramatic, but for people that don't know your practice, like who's the typical patient? And today's topic, full mouth reconstruction. Give us kind of a working definition of what that means.
It's a great question. So, a lot of people are going to come to me more intimidated or embarrassed by their smile. Okay. Those are usually the typical patients that are going to come in. They're going to have either gum disease or a lot of cavities, and they're typically having a hard time chewing or eating the foods they like.
What are the symptoms of gum disease?
Good question. So gum disease people first notice it by either having bad breath or noticing their gums bleed every time they brush their teeth. The worst, though, are the ones where their significant other or their children or their grandchildren come to them and say, your breath stinks. I can't stand it, grandma or grandpa.
So it's a bacterial infection?
Yes.
So it kind of makes it, so you can't brush that out kind of a thing?
No, it's got to be professionally taken care of.
Okay.
Yeah.
So that your typical patient is that type of patient that has like really broken down mouths, things like that. So full mouth reconstruction means what? I know it's a dental term.
Yeah, so it's a dental term, and sometimes dental terms can get a little confusing, but essentially it's, if somebody comes to me who's born in 1965, imagine you had a car that was from 1965 that needs a little bit of a restoration. It's kind of a similar thing. So when you do a full mouth reconstruction, we're talking about a combination of different things, whether it be fillings, gum disease treatment, crowns, bridges, veneers, implants,
okay,
a whole host of things to try and get their mouth. Well, two things we're looking for. We want to get them healthy, but we also want it to look good.
Okay.
So for full mouth, we're not necessarily talking about taking out all of their teeth. We're usually trying to figure out a way that we can save teeth, see what we can do to try and work with what we have. Okay,
good. Now in your office, because you're one of these centers, and correct me if I'm wrong, that you kind of do everything right there. Like what typically may require, the root canal guy, the endodontist, or the prosthodontist, or the surgeon, what you're doing is you're doing it all right there. I mean, rarely you send things out.
Completely in-house.
Okay.
Yeah. We do everything under one roof. Yeah.
And you have a lab where you actually make teeth?
We do.
On site?
On site, yes, sir.
Is that why you do things so quickly?
Yeah. So what's great is, patients will come to me and they've got a broken tooth and they only have a limited amount of time. They can either be off of work or sometimes they're in Tampa vacationing and they don't have time to come back to get a tooth cemented back on. So we'll make it right there same day.
So you brought some photos. What are we looking at?
I did, yes. So this is one of my favorite cases.
Okay.
This patient comes to me, and the first thing he tells me is, I want to look like a Hollywood movie star. And we kind of laughed about it, and I said, okay, what movie star do you want to look like? And he said, Ben Affleck.
Okay.
And so we kind of got to joking about it, and now his nickname in our office is Ben Affleck.
Is that right?
And it's still...
Every time he comes in?
Oh, every single time. Every time. I mean, we haven't quite changed his name on our schedule to Ben Affleck, but the moment he walks in, everyone greets him as Ben Affleck. It's very funny.
So what are we looking at here? I mean, he seems like, decent teeth right there on the before.
Yeah, so when you look at his before photo,
right,
he had some bacterial infection in his mouth that was causing issues with his gums. It was causing problems with his teeth. He had a lot of discoloration in his teeth. He just didn't like the way he smiled.
Did he not smile because of it?
Very little, very little. I mean, even this before shot here, we had to force him to give us a smile. What was funny, he had great personality. Amazing guy, just the light of the room. He walks in and he's always got a great personality, but he was hiding his smile.
Okay.
And he knew it. He knew it because his first thing he said to me when he came in was, I don't like my smile. I've got to change something. So once we got into figuring out, okay, what can we save? What can we not save? Really, he had a pretty good foundation. We could save his teeth. It was just more about a cosmetic thing as well as getting the disease under control.
But he had really bad teeth and gums.
Oh, yeah.
Okay.
Yeah. Had.
Okay.
Yeah, now he doesn't. Yeah, so when we actually got to put his final teeth on, it was a very joyous time for him. He looked in the mirror, he started smiling, and to this day, we still call him Ben Affleck. We always, in our office, we have these little radios on our ears to communicate. We've got a big office.
Okay.
And when a patient comes in, the front desk will radio back and say, the patient so-and-so is here and ready. And we always radio back and say, Ben Affleck is here and ready to go, and we all know who he is.
That's funny, that's funny.
So when you look at his before and after, there's a couple of things that I noticed that just side by side you can tell.
Okay.
Number one, he looks happier.
That's true.
He looks younger. His eyes, just something about his eyes even looks different. And the things that have made it different for him, number one, he's more confident. He loves to smile. He can eat what he wants to eat. That's not an issue anymore for him. And he's just a whole new man. He's almost like he's 20 years younger. So the neat thing about him is if he had gone into a lot of other offices, they would have just said, take all the teeth out, do implants, do dentures, something like that. In his situation, we really didn't have to do that. And the beauty of our office at Optum Dental Arts is we don't have to do that.
What does that mean?
We don't just do one thing.
Okay.
We do dental implants, sure, but we can do everything else under one roof. We can do bridges, veneers, we can do cosmetic, we can treat disease in the gums. We can do just about anything that needs to be done all under one roof. It's not not one of those places that you go to and this is the only thing we do, so it's the only thing we're going to push on you.
Okay. And what's it like when a guy like this sees himself in the mirror for the first time?
Oh, tears. I mean, a grown man crying. Yeah, it brought tears to. I mean, my assistants were definitely crying. I think for me, somebody was cutting onions or something in the room. I was definitely not emotional.
What do they like more? Like, what does this guy like more? Because you said he had a tough time eating. Does he like what he could eat, or does he like the way it looks?
Every patient's a little different. I think for him, it's more the way it looks.
Okay.
Because that was his first complaint when he came in was, I don't like the way my teeth look. Now that he's had them, able to go and eat and chew and function on them, obviously that's a big thing for him. But everybody's got their thing. Everyone's got their one reason of why they're coming. You know, I'll have patients come to me and say, I had a gal a couple of months ago that she said when she was little, she used to take a radish and bite into it like an apple, raw. So I've never heard of that before, but that was her one thing that she hadn't been able to do in years. And to be able to give her that again, because her teeth were loose and she couldn't chew, she couldn't function. Cosmetics weren't her issue. I mean, obviously she wanted a pretty smile. We're not going to make pretty ugly teeth, but she wanted function. In his particular situation, he wanted aesthetics. He wanted something to look nice. All right, now let me show you this next patient.
All right.
Now, this is actually my sister. Now, if I tell you that what I say I believe, I will do it to my own family members, absolutely will.
Okay.
So my sister comes to me. She lives across the country, so she wasn't normally coming to see me as a dentist. Plus, I haven't always been a dentist, and so she had a lot of other dental experiences in the past. And her complaint was, every time I go to the dentist, I've got another problem. I've got another infection. I've got another cavity. I've got another something going on. When you look at her first smile, it's not bad. You know, her front teeth seem to be there. It doesn't look like she's missing anything. She, mostly in the back, was missing a lot of back teeth. She had a lot of infection.
Why is that so bad, missing teeth in the back?
That's a good question, because what happens when we chew is the back teeth are actually the workhorse. They're the ones that are going to be pounding and grinding and chewing the food. The front teeth are only meant to be like a pair of scissors. They're just there to cut the food up, push it to the back. Well, if you're asking the scissors to do the workhorse, what's going to start happening is those front teeth are going to start to flare out. They're going to start to crack. They're going to be more prone to getting more bone loss, gum disease, other issues just by missing the back teeth.
So if you're missing your back teeth and this is your sister, do you tell her, like, you're going to end up losing all your teeth?
Oh, absolutely. And it was very emotional for her too.
Okay.
Yeah, absolutely. So that's the issue that's going to start coming up is people say, oh, it's just my back teeth. I don't really care about it. But without understanding the long-term consequences of missing your back teeth.
It's how people lose their teeth.
Absolutely.
Interesting.
Yeah. Now take a look at the after of her. With a combination of different procedures, we got
Very nice.
We got her disease taken care of. Her teeth are straighter, they're whiter, they're prettier. She can chew now. And obviously being my sister, she was very, very emotional, gave me a hug. And just if any of my siblings are out there watching, she said I am now her favorite sibling for fixing her face. Now the thing is with her, as you see, these are issues that she was dealing with for several years, 10, 15, 20 years, and just putting it off. You know, she'd go and get one little problem fixed, one little thing fixed here and there. But if she continued down that same path, for sure she would have been in dentures. There's no question. Is that right? Yeah.
Okay, good. Now you have more photos. What else are we looking at?
Yeah, absolutely. So here's another great one. Again, with her, it was both a kind of a combination, with a lot of patients, a combination of both cosmetics as well as function. The first thing she said to me after we fixed her smile was, I should have done this 15 years ago. I can't believe I waited this long. Her kids said the same thing to her. Said, Mom, you look 20 years younger. Why did you wait so long to get this done?
Now, her teeth look pretty bad. Is that unusual?
Not unusual at all. No, with hers, it was patchwork. It was big fillings all over the place. And a lot of the fillings just had a lot of problems with them that were causing, areas where bacteria was getting stuck and it was causing discoloration. Her gums were bleeding because of it. She was in pain. She didn't like the way
So
it
you
looked.
clean all that up?
Oh, absolutely. Everything.
So even if you have bad gums, you get this done?
Yeah.
Like
yeah.
even crown, bridge, veneers,
Everything.
with really bad gums. You just clean it up?
Clean
this
it all
bacterial
up.
infection?
Yep. So the issue with her was she doesn't usually smile. And so most people didn't even know she had a problem with her teeth because she would smile without showing them. Or she would, when she'd laugh, she'd cover her face up. And so that's very, very common. And a lot of people are walking around right now with that exact same problem.
Can you spot them? Like they look mad maybe? And they're
Oh, I
just
always
hiding
can. I always can. If somebody, friends or things on Facebook, on social media, I can tell.
And they're never showing their teeth.
When someone's never showing their teeth, I know they're embarrassed by it.
Is that right?
Yeah.
And it's usually an easy fix. I mean, I know it's technically demanding on your end, but in a way it's kind of an easy fix.
It's very easy. Most of these pictures you're seeing were done in one day. So this is just a single day, one procedure that we can fix their smile, change their confidence, and I know this sounds a little cliche, but really change their life.
Now, with technology, you've talked a lot about the technology you have in your practice that makes it a lot easier and better for the patients, and what used to take like a year, you can do it in one visit.
Yeah.
What is some of that technology?
So one of the neatest advents of what's going on right now in technology is you see AI that's out there. We use AI for a lot of different things. For designing the teeth, we actually use AI. We have 3D printers. We have special 3D scanners.
To make teeth?
To make teeth.
Okay,
yeah,
okay.
Yeah, and we actually also have this a 3D X-ray machine. There's only a couple of these in the whole state of Florida. It's the same kind of CT that you would get if you go to the hospital, the lay-down CT. In this new technology, they made it stand upright for dental offices. So not a lot of dental offices even have this kind of CT, and it gives us very, very clearer definition than any other 3D X-ray I've ever seen. What this means is there really is no guesswork. I can see everything before any procedure. I can see the bone level, the height. I find infections well earlier than others can find because of the preciseness of our technology.
You say you plan things on the computer.
Yeah.
How so? Like if there's a surgical procedure involved, everything's done on the computer?
Everything is done on the computer. Surgically, if it's restoratively, if it's making a crown, a veneer, an implant, everything is all done digitally prior to even touching the patient.
How are you able to show them, or can you show them, what their teeth are going to look like ahead of time?
So we'll take a lot of photos. We'll have a lot of 3D scans prior to, and we can actually do a digital smile design.
Okay.
So we'll put it up on the screen in front of them, and you can actually see what you're going to look like before we even touch you.
What do they say to that?
Oh, it's usually, oh, that's not possible, or oh, there's no way I can look like that, or
so they're surprised.
Or they'll say, is that even me? Well, that's a picture we just took 5 minutes earlier.
Do they ever say, I want that?
Yeah. Oh, all the time.
Is there? Now, what about sedation? Because look, people don't like going to the dentist.
No.
We've talked about. Do you still hear that, by the way? No offense, Doc?
All the time.
Okay.
I can't tell you how many times somebody says to me the first time they meet me, no offense, but you know something bad's going to happen after they say but no offense, but I hate the dentist. And it's usually a handshake, and it's nice to meet you as well.
Do most of your patients take advantage of sedation?
I'd
they're
say,
obviously numbed up.
Yeah, I'd say probably about half.
Okay.
About half our patients decide, they want to be sedated. They want to be asleep. And we've got a lot of sedation options.
Like what?
So, I mean, you can do anything from a pill that you take before the appointment that you're technically awake for it, but it gives you amnesia. You don't really remember it much. All the way down to hospital-grade general sedation with an IV. So I have a dental anesthesiologist on my team where you are going to be completely asleep. This isn't moderate sedation. Now, this
but you
is
could
actual...
have just IV sedation.
Oh yeah, yeah, and that's the long range of how deep we can go. We have the full capability to go as deep as.
I mean, do you have a goal to make them like where they're not afraid anymore?
Oh, absolutely. Like when I talk to my colleagues, other dentists, they hate seeing fearful patients.
Yeah, I hear that. Yeah.
For me, it's the opposite. When somebody's on my schedule and they'll tell my scheduling coordinator or something, or on the new patient paperwork that they're terrified of the dentist, I look at that as a challenge. I say, all right, I cannot wait to meet. Oh, absolutely. I cannot wait to meet this patient because I have been in their shoes. I get it. I understand, and there's a much better way.
Now, for people just tuning in, we're talking about extreme smile makeovers. So we're not just talking about basic crown and bridge. We're talking about redoing the whole mouth.
Yep.
Helping get rid of any gum infections, things like that, and giving them the smile they've always wanted.
Yeah.
Is that correct? So let's take a look at the next one.
All right. So this patient here, he comes to me. He's actually a salesman, a car salesman.
Okay.
And he started selling cars during COVID wearing a mask. Didn't have an issue. He's got a great personality. He could smile. He could laugh. He's wearing a mask. It wasn't a problem. As COVID started to come towards an end and people start removing their masks, he didn't want to because he was embarrassed about his smile. So eventually he said, I had to take the mask off, and I noticed that people were treating him differently, or at least he felt.
Like judging him?
He felt like people were treating him differently. They probably were. And you'd be surprised how many times people get judged for their smile, for their teeth. So for him, we had to customize his smile. You can see his smile is a little off because of how his lip goes up a little higher on one versus the other. It's not this just cookie cutter mold where we just make a tooth or make a set of teeth that look exactly the same. So it has to be customized and individualized for him. Oh yeah.
Looks like a completely different guy.
It does. It does. It's a very, very short distance, short time. I think it's only a couple of weeks between each of these photos. Now, Randy, look at the before and after there.
Okay.
Look at the difference look at the way he's smiling. Look at his eyes. Which one of these two would you trust to sell you a car?
Well, one looks more credible than others. There's no doubt about it.
He does. He looks more credible. And the only thing that's different in this photo are his teeth.
His teeth.
Same person.
Very nice.
People judge based off of the smile. It's sad to say, but people are casting judgments on what your smile looks like. What's interesting about him is he started selling more cars at his dealership, and his boss noticed.
Okay.
So his manager comes in to see me, and his manager says something kind of similar. Hey, I love what you did with my coworker's smile. Can you help me? Now, he's not on the floor selling the cars. He's the manager of this dealership. But again, the same thing. He noticed that his smile was different. He wanted something.
And he had really bad gums as well.
So he had really bad gums. He had a lot of loose teeth as well. He had some teeth. If you look on his photo, some are longer than others. They're just not proportional. I think that was originally from an accident he had as a child running into something. And so they were misshapen. They were different colors. They were just not in the right position. So again, when we look at this comprehensively, we look at how we can do this as a big picture, all in one location, we can handle it all. We can do root canals, we can do crowns, we can do veneers, we can do implants, we can do the whole mouth in one setting. And so we look at these patients as individuals. How can we fix your individual situation? There's not one cookie cutter.
It looks good. There's no doubt about it.
It's not a cookie cutter fix for every person. You have to look at each individual as a person.
So this is a very complex case to take care of as a dentist?
Absolutely. Every single one of these cases are very complex. This is not just
You brought the
simple.
tough ones.
I didn't show you the easy ones. Yeah, these are the harder ones.
And if it's done right, this can last for how long?
The rest of their life. The rest of their life.
Okay.
The goal with this is if properly maintained. And that's another kind of caveat between me and a lot of others, is not only are we going to fix it, I've got hygienists. You're going to maintain it at my office as well. And we're going to continue to work with you on oral hygiene. We fix the problem. How do we stop you from getting back to the original problem as well? And keep you healthy. All right, so this gentleman, just one of my absolute favorite people in the world. Just such a great guy, such a sweet person. He comes to me, actually, the first time I met him was the ribbon cutting ceremony of our office. We got the big ribbon, the big giant golden scissors, and he's helping me cut the ribbon there. And he was working with the Chamber of Commerce there, and comes to me after everything is done and everyone's starting to kind of disperse at the end of this ceremony and says, "Doc, I have a problem. His front teeth, they look okay. They don't look too bad. He's got his front teeth. He's missing a lot of back teeth. He's got a lot of issues, a lot of bacterial infections in his gums. He's got a lot of cavities." He says, "I'm embarrassed by my smile. I don't usually smile." If you look at this before photo here, that's a forced smile.
He didn't smile.
He would not. I said smile, and he gave me this no teeth smile, and I said, "No, we're taking a before photo. I need to see those chompers. Show me those teeth." And so I had to tell him kind of a little dad joke to really get him to smile. And I don't have very good dad jokes, so it took a while to get that smile out of him. So we got him to smile, took that photo. This has completely changed his life to the point where after his mouth is fixed, after we restored him, that same day, he goes out to a taco shop and he's eating tacos. And he said this is something his dream. He wanted to bite into a hard, crunchy taco because he hadn't done this in years. Bites into this taco and he said he starts to cry. The waiter comes over and asks if he's doing okay. And he reassures him, yes, this is something that I've missed. I haven't been able to eat like this in so long.
And he gets choked up.
And so much so that after he eats at the restaurant, he comes back that same day.
Tells you at your office.
At my office, comes back to the office to give me a hug and to thank me again that he's himself again.
I mean, look at that after.
Oh yeah, that was
like a
not,
different guy.
Not a forced smile at all. I said smile and immediately popped into it.
So, we talked a little bit at the break, though. It's kind of like they're hopeless, meaning they're without hope. They think nothing can be done.
Yeah.
Was that him?
Oh, absolutely.
Like he's going, like he had very low goals when
exactly.
it came to his smile?
They come to me and they say, there's got to be a fix, but I don't think they really understand how much we can do to fix their smile. Most people just say, oh, I saw this whitening commercial it came across my social media. Can I brush with this toothpaste and fix everything? Or can I get one of those little snap-on veneers and everything's great? They don't really realize that we can change their whole smile, both aesthetics and function. And health. That's the most important thing. All of these people that I'm showing you photos of, they're now healthy. They're noticing they're
eating better.
They're eating better. Their cholesterol is better because they can eat better. Their blood pressure is better. Their social life is better. It's just this whole life-changing event by just changing their teeth. Okay, let me show you this next patient.
All right.
Now again, when you look at him, you see the before and after photo. A very common thing that I see, a lot of men especially, will grow their beards out because they don't want to show their teeth. They don't want to show their smile, and they try to hide it. He was very embarrassed by his smile. He did not like it at all. He originally came to me just for the top teeth, and we were able to fix that. We were able to get him teeth in the back, fix the front teeth, so cosmetically it looked better.
Okay.
But he still wasn't able to really chew everything he wanted to because we hadn't addressed the bottom. For financial reasons, he wanted to wait a couple of months.
Okay.
So a few months later, he comes back to me and we fixed the bottom. Same thing. Save some of the teeth we can save, fix the back teeth, get him to a point where he can actually chew, he can function again, he can eat the foods he wants to eat. That's really what this comes down to. People don't understand that you can eat again. You can bite into those hard things. You can eat that steak, you can bite into that apple. But they've gone so many years without it that they just think that it's a lost cause. They're going to be indentures like their grandma. And that's it. That's the end of the road. There are so many ways to fix where they are, but they've just got to come in. They've got to have that consult. They've got to come in and meet me. We've got to figure out a game plan. The longer you wait, the worse the problem's going to get.
Now, at your office, because it's one doctor, one fee, rather than going to multiple specialists. I mean, nothing against the specialists. In fact, you even said you want to be positive on the show today about the specialists. But because you're doing it right there, it must be less expensive.
It is.
One doctor, one fee.
It's less expensive and it's faster.
Okay.
Because, and I hear this all the time. Well, I had to go to this doctor to get a root canal, and then this doctor to get my gums worked on, and then to this doctor to get my fillings, and then I had to go to this doctor to get my implant. We do it all on the same appointment. If you're already numb, why not do it all at the same time?
So you're always traveling, learning about this stuff?
Yeah, all the time. I got some advanced training when I was in the Army. I did a residency in the Army and got advanced training in root canals, in surgery, in implants, in ortho, in actually doing braces. I mean, we got the full training when I was in the Army. But after I got out of the Army, I'm just constantly learning. I don't know if it was maybe because I started a little later in my career as a dentist, where I feel like I'm always trying to play catch up. But I am taking continuing education courses constantly.
You know, a guy in Tampa, a well-known oral surgeon, I was speaking to him. He goes, Randy, there's this new breed of he goes, it's not a recognized specialty, but like a super specialist, where they learn to do everything. Yeah. Is that kind of
it is, yeah. Kind of my colleagues, they call it a super GP. Somebody that really does everything, refers out very little. I very rarely am going to refer out.
But if somebody even has bad gums, they're not. What about age ranges? Like, what's the oldest patient that you've done this full mouth reconstruction on?
98 years old.
Really? Why would a 98-year-old want to do this?
So at 98, they're not worried about longevity. They want to eat. They want to chew. They want to enjoy their golden years, whatever years they have left. And again, we're not trying to get 20 or 30 years out of this for him. We're trying to get him something that he can function and he can enjoy life. And for him, it was absolutely life-changing. I had another 92-year-old that we did full mouth reconstruction on. He actually originally went to Mexico to have it done, and it was just a total disaster. Things were all over the place. Teeth were everywhere. Nothing matched right. Came back to me. We fixed him up. We got him back healthy again and got his teeth right. He was actually one of the original Navy SEALs. And guy very, very active, 92 years old, still dives and does videography for National Geographic in the ocean, underwater scenes in his 90s. So very active guy. But again, we're not looking for longevity. He couldn't function. He couldn't enjoy his life. And somebody that loves life like this man, he wanted to be able to eat. He wanted to be able to just bite into that steak or bite into that food that he couldn't before.
So when a 70-year-old goes to your practice and says, Doc, am I too old for this?
I try to hold back the laughter. I do, because I mean, I don't want to be insensitive, but you're at 70 years old, you're kind of middle-aged for my practice, because there is no too young or too old to get this fixed.
So at the top of the show, and we're out of time, when we say, that your teeth and gums are never too bad to have the smile you've always wanted, you believe that's true?
Oh, absolutely. 100%.
And you see it all the time?
I see it every single day walk through my doors.
Because you get the complex stuff. People that think they can't be helped.
I get the stuff that come to me. I have other doctors, other general dentists in the area that also refer to me for specialty procedures and things. And it's usually, they don't have the bone for this, or they don't have enough tooth structure for a bridge or for a crown, they, whatever the situation is, they're usually told no, it can't be fixed. And when they come to me, I'm usually telling them yes. Very rarely am I saying, you're a lost cause. There's always a way to fix it.
We got about a minute left.
All right. Let me just show you these two quick ones real quick, Randy. These two are just fantastic.
Okay.
This gentleman, same thing, comes to me. Teeth are a mess, very loose, can't chew, can't eat. He says, I need to have something. I mean, people are telling me I'm going to have dentures. I can't wear dentures. We fixed him. This was 24 hours later. You see that photo?
And this is a full mouth reconstruction.
Full mouth reconstruction. Literally, that first photo was the day before his procedure. The next photo was the day after his procedure.
Looks nice.
One day.
Big difference.
This is another one. She actually is the wife of one of the biggest labs, the dental labs in Florida.
Okay.
And he sees thousands of dentists' work come through his office, and he says, I only want one doctor working on my wife, and that's you, Dr. Davies.
That's nice.
Yeah. So exact same thing. She was told that everything is too far gone. You've got to have dentures. You've got to have everything taken out. She already had some dental implants and some other things in the back of her mouth that just weren't really done correctly that we were able to fix. The whole mouth, again, we're looking, in her particular situation, we're looking, I think it's about a 2-month difference in that before and after photo. But her smile is completely different.
It is. Looks good.
Yeah.
I'm trying not to side with you. I'm just asking the question, but it does look good. Okay, we're out of time. So final message. Somebody watching this, and they have really bad teeth and gums.
Yes.
And they're not ready for a whole mouth of extractions, and they're fearful, etc. And they're skeptical. They've heard what you have to say. Yep. What do you say to them?
Okay, first off, it's never too late.
Okay.
It is never too late. Give us a call. Let me at least look. We do free consults. Come in.
Okay.
Let me take a peek. Let me see what we've got. Let me see what we're working with. And just know that what we're going to do is we're going to care for you. We're going to listen to your desires. We're going to listen to your wants, your fears, your concerns. We're going to give you a path forward, a way to fix where you are. It's never too late. But also understand that the longer you wait, the bigger the problem can get.
And the more expensive?
And the more expensive, yeah.
The longer you wait. Well, look, I want to thank you for coming to the show. Great stuff.
Thank you, Randy.
Now, if somebody
it.
wants to make an appointment, do they go online to do it, or would you prefer they just call your practice?
Both. You can go online. You can request an appointment online. You can give us a call. You can talk to our wonderful team at the front desk.
Okay. Well, Dr. Davies, thank you for coming to the show.
Thank
Great
you.
stuff.
Thank you for having me. Appreciate it.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.